Hello everyone, how are you today? Welcome to my channel. This is Dr. Education and I am Dr. Paramjeet. Those who don't know me, I am a consultant physician, cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Ghaziabad, Delhi NCR. And this is my channel and I make videos about simplified medical explanations. I give you information, authentic and simplified information about health and healthcare topics, and there are already a lot of videos made on my channel. You can go browse and look for your favorite health topic, and I will assure you that you will get authentic information, simplified language on my channel. So if you haven't checked it out, do check it out, and if you like the videos, then do subscribe and hit the bell icon, because that's how you're going to get notifications about the upcoming videos. So today's topic is kidney stones, and we are going to talk about everything you need to know about kidney stones, including what are kidney stones, how they are formed, what are the types of kidney stone, what are the causes of kidney stones, what are the symptoms and signs of kidney stone, what are the treatment and preventions of kidney stone, what diet, what you should eat, what you should avoid if you have kidney stone or a risk of kidney stones. So all these things will be covered today and in this upcoming videos as well. So kidney stones will have a playlist, so do check out my channel for a playlist of stones. So we'll include kidney stones and other stones into the playlist. Hope you like the video, so stay connected, stay healthy. Let's start.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Guys, as we know that kidneys are the main organs which filters out the blood and it makes urine. Urine has a lot of unwanted substances which are present in the blood. Anything which is excess most likely will be excreted through the urine or the feces or perspiration. Some way or the other it is supposed to go out of the body. But kidneys are the main organ which do that, which help us out. So we are supposed to make at least 1.5 to 2 liters of urine every day. So what are kidney stones? Kidney stones are basically a crystallized form of any substance which gets collected and then forms a pebble, a stone inside the kidneys or the ducts, the pipeline which takes urine from both kidney into the bladder. It can form into these pipelines. This is called ureters, and they can form inside the urinary bladder and even outside, which is going from the urinary bladder through your external genitalia through outside. That is called urethra. So it can form, kidney stones can form in the urethra, in the bladder, in the ureter, or in the kidney. So anywhere in this we call renal stones, kidney stones. They are also called as ureteric stones or cystic or urinary bladder stones or urethral stones. So stones can form anywhere, but you have to understand the stone can be formed in a different location. Say they are formed in the kidney, and then they can pass out through this whole pathway and they can go out. They can get out of the body without causing any problems. Usually this happens, but many times the stone can get stuck, and it can get stuck anywhere. But there are three most common locations where these stones can get stuck, and these three locations are the three most narrow pathway in the pathway of urine. So we don't have to look into the details of these three locations, but yes, I'll give you an idea. First locations is at the junction of kidney and the main tubule, the ureter. Then second is the junction of the ureter and the bladder, and third is the junction of the bladder and the external urethra. So at these three locations, significantly bigger amount of stone can get stuck. Now you have to understand, stones, kidney stones are basically made up of anything which is heavy and present in a very large amount in the urine. So what are the most common types of kidney stones? The most common type of kidney stones is calcium stones. Yes, but calcium does not make a stone by itself. Calcium combines with oxalate or phosphate. So most commonly kidney stones are either calcium oxalate stones or calcium phosphate stones. So first type of kidney stone is calcium. So if you have a lot of very high amount of calcium in the body, plus if you have high amounts of oxalate or phosphate, then they can form a kidney stone. But that is not the only reason. We'll look at other reasons which is the major reason for kidney stone. That does not mean you'll stop eating calcium, because a normal amount of calcium is very important, very much necessary for your body functions. Low amount of calcium also causes kidney stones. How I'll come to that. So the first type of kidney stone is calcium stones. The second type of kidney stones are uric acid stones. So if you have higher amount of uric acid in the blood, they can get crystallized, they can get together, form a stone, a pebble inside the kidney or in the urinary tract and form a stone. So uric acid stones, calcium stones. Third type of stone is struvite stones. Struvite stones are less common, but they are usually seen in urinary tract infection patients. Those patients who have an infection of anywhere, either kidney or ureter or bladder or urethra, anywhere along the urinary tract, these patients can develop a struvite stone. Then the fourth and very rare type of kidney stones are cystine stones. And cystine stones are usually running in the family. That means if your family has a very regular history of kidney stones, you might consider testing yourself for a cystine stones. And guys, let me tell you, there is no other way of telling what type of stone you have without actually examining the stone. Or you have to test your urine or blood to check for higher amount of any of these substances. So if they are present in a very high amount in your blood or present in a high amount in urine, then most likely the stone in your urinary tract is because of them. So what are these substances? As we've seen, high amount of calcium, along with calcium, oxalate and phosphates, then high amounts of uric acids, then if you have urinary tract infections and cystines. So all these things have to be considered. So these are the four major types of kidney stones, and we have to see now what is the basic reason for kidney stones. So guys, there are three basic reasons for kidney stones. Every single reason in the world which can lead to kidney stone can be summarized into these three. First and the most biggest reason is not calcium, not uric acid, not diet, nothing. The biggest reason is your water intake. Yes, if you take less amount of water, you are dehydrated, your kidneys will not have enough filtrate, will not have enough pressure to flush out the substances. You can form kidney stones even with normal amount of all these substances. So the biggest reason is not drinking enough water, not drinking enough fluids, not forming enough urine. So if you're not forming enough urine the whole day, that means around 2 liters of urine in a day, if you're not forming it, or if your urine is in dark colors, dark yellow or brown color, that means your urine is concentrated and you're not drinking enough fluids. So that is a very high risk of developing kidney stones and kidney diseases, renal stones, and even urinary tract infections can happen because of this. So the biggest reason is dehydration, drinking less fluid. So I cannot emphasize this enough. Biggest thing which you can do to avoid kidney stones, drink a lot of water, lot of water. So first reason is water, fluids. The second reason, guys, the second reason obviously is very high concentrations of these substances in your blood. That means high uric acid, very high amount of calciums. Very high amount of calciums are seen in patients who are very regularly taking calcium supplements, plus they are taking calcium based antacids, plus they are taking a lot of calcium, high calcium foods. So all these things, they get concentrated and can form stones. Then not just calcium, let me tell you, calcium is not the culprit here, but oxalate is supposed to be present in a high amount, and phosphate is there. If they are also high, if they are high, then only calcium can actually form these things. Then we come on to uric acid. Is also a lot of people who have high uric acid, especially if they have a very high protein diet. And we have made a totally different video on uric acid, specially made on uric acid. We have explained every single aspect you need to understand about uric acid in that video. So do check out my channel for that video if you haven't seen it already. So we have seen higher concentrations of calcium, uric acid, phosphate, oxalate, and then urinary tract infections. That means the third reason for having a kidney stone is medical diseases, medical conditions. Yes, that is one of the reasons. So a lot of medical conditions can lead to kidney stones. Now, how they can lead to kidney stones? The biggest problem with medical conditions is, one of the medical conditions we've seen, urinary tract infections. The other condition, there are many conditions which can affect the kidney or the functioning of the urinary tract. Now, you need to understand there is a peristaltic motion inside the urinary tract. As I already explained, one part contracts, the other relaxes, this contracts, this relaxes, this contracts, this relaxes, so the urine flows forwards. Now, if because of an infection, a disease, if there is a blockage, if there is something pressing, if there is a tumor, if there is hormonal imbalance, a lot of diseases are there which can affect the functioning and the structure of this urinary tract. And if there is any problem in this, there is more chances that the kidney stone will be formed. So these are the three reasons why you can have kidney stones: drinking less amount of fluids, having high concentrations of stone forming substances, or having a medical disease which affects your urinary tract. So what can be the signs? So if you do have a kidney stones, what will happen? Usually a small amount of kidney stones are easily passed without causing any symptom, signs or problems. But if your kidney stone is stuck somewhere, because stones are not always a very smooth surfaced structure, it can have thorns, it can have irregular surfaces, it can have any shape for that matter, right? So sometimes it can form into the shape of a stag horn as well, especially inside the kidneys if it is a very large shape, very large stones. So stones can be from a size of a granule to a stag horn, a big stone as well. So depending upon the size and the shape, the stone can get stuck anywhere. So if the stone has any pointed surfaces, it can actually cause abrasions and damage the urinary tract anywhere while passing down, and therefore cause pains, infections, and even blockage. When it gets blocked, what will happen? If the stone blocks one of the urinary tract, obviously urine will not be able to go down, and the pressure will cause swelling in the upper parts of the urine, and even there is a swelling in the kidneys. Now understand, because of just blockage you don't get any symptoms. First of all, what will happen, because your urinary tract and your kidneys do not have any nerves to cause alarms or pains, but there is a covering on the kidney. The covering of the kidney has nerves. So what happens when the pressure causes swelling in the kidneys? Because of this swelling, the kidney's capsule, the covering is stretched. That causes pain. So if you are having kidney stone pains, the problem has been there for some time and is now causing something called as hydronephrosis. The kidney is swelling and causing stretching on the capsule, causing pain. Typically the pain will happen somewhere around the middle or lower parts of your back. Sometimes the pain can come forward, sometimes the pain, if it is in the urinary tract, ureterus, can go from here to down. So there is a different radiation of pain depending upon the location of the stones. But there can be pain. Then there can be burning micturition, there can be infections. If there is any abrasions, if the stone has caused a trauma inside while flowing down, it can cause bleedings, it can cause serious infections also. Pus collections are also seen sometimes. So all these things are the symptoms of urinary tract. Sometimes obstructions is seen, that means decreased amount of urine. So all these things can happen, and sometimes the symptoms actually vanish all of a sudden with a gush of urine. Obviously that is an indication that the stone which was blocking has just passed. So all these things are signs and symptoms. Sometimes we can actually palpate the kidney when we try to palpate the abdomen. If the kidney is nicely swollen, So all these things are the symptoms. Now how do you treat it? Treatment of kidney stones depends upon the size and location, and obviously if there is any complications, all these complications which we talked about. If there are no complications, if there is no significant problems in the kidney size, and we find a stone, and if it is less than 1 cm size, then that stone has a very high chances of passing through the urinary tract without causing much problems. And for that, the biggest management is lifestyle changes, taking a lot of fluids, doing a lot of jumping exercises, taking some alpha blockers, muscle relaxants which can relax the urinary tract so that the flow, so that the stone passes easily. Sometimes we have to give antibiotics and painkillers to relieve the pain of the stone. Sometimes it can lead to gastritis, so antacids. So these all are included in the medical management of kidney stones. But if the stone has caused problems, if the stone is very large, then we have to consider some procedures. Now, what are the procedures? The first is lithotripsy. We use a shock wave from the outside of the skin to actually electrify and shock break the stones into smaller pieces so that the smaller pieces can pass through the urinary tract easily. That is called as lithotripsy, shock wave therapy. The other type of procedure is we can actually put a small thin pipe, cystoscope. If the stone is there inside the bladder or in the urethra, we can pass a small microscope and we can actually catch the stone and take it out. Sometimes we can even take it out from the kidneys. There is an option of lithotripsy, there is an option of putting a cystoscope or a microscope inside the kidney. Third procedural option is obviously surgery. So surgeries can be done for a very huge size of stone, especially if the area has already got infected or there is any pus present in the kidney. So all these are options which is considered on the patient to patient basis depending upon the condition, symptoms and signs and the problem. The doctor does all this test and then decides what is the best plan of management for your case. So that is all about kidney stones for today, guys. Next video I'm going to tell you what kind of diet you should take if you have a kidney stone, what kind of diet prevents kidney stone, and what other steps you can take to prevent kidney stone. That will be considered in the next video. But today this is it. I've told you much about it and hope you liked the video. Hope you have enjoyed this session with me and hope you are watching other videos on my channel. If you're not, then do check them out. They are worthwhile and I'm sure you won't regret it. Don't forget to subscribe and hit the bell icon, guys. And if you like the videos, do share this videos to all your friends and family. I'm Dr. Paramjeet and you're watching Dr. Education. Till next time, stay connected, stay healthy.